Bismillahirrahmanirrahim. In this series of videos, we are going to discuss the disorders of pigmentation and melanocytes. Melanocytic nevus are also termed as pigmented nevus or commonly known as mole, are the benign proliferation of the melanocytes. These nevus is a term that is derived from a Greek word that means nest. So these are nests of the proliferating benign melanocytes that are there, and these are basically due to activating mutation in the components of the RAS signaling pathway. The acquired melanocytic nevi are common type and found virtually in all individuals, and these are localized benign neoplastic proliferation of the melanocytes within the epidermis or dermis. The number of the nevi uh, depends on the exposure to the light and also on the innate susceptibility of the person for the development of nevi. There are 10 to 50 nevi on the skin regardless of ethnicity or skin color, and there are two basic interests in the nevi. One is their cosmetic significance. As you know, there are many songs and many poetry. The poet praises the mole of the beloved one on the specific part of the body, and also the scientists have interest whether they transform into they transform with the atypical features, or do they transform into malignancy or not. So most stable, but 30% of the nevi they may undergo in malignant transformation. The skin of the blacks has got nevi, but these are less common in black colored people, and it is not associated with increased risk of melanoma in dark skinned people. But the the mole or nevi on the palm, sole and genitals, even if they are in the black skinned people, they have got the same risk as for the white race. The nevi usually do not develop on the skin that is not exposed to sunlight, but there is unequivocal causal relationship between exposure to ultraviolet light and melanocytic nevi and malignant melanoma. Some people with the fair skin form relatively few nevi, but the dark skin occasionally develop numerous nevi. So the ability to form the nevi is under genetic control, the innate susceptibility of the person to develop a nevus. So these are linked to the polymorphic variant of melanocortin receptor, and there is variation in the ratio of pheomelanin to eumelanin. We have seen in the introduction video of the melanocyte that there are two types of this melanin. One is the pheomelanin and another is eumelanin. These pigments are associated with red and brown hair. The red one is for pheomelanin and eumelanin for the brown one. They are also associated with the susceptibility to the burning and tanning. There are two groups of the pupil. One is the group of the people or individuals at risk of melanoma. Actually, both are on the risk of melanoma, but this first group is the group that has got the skin that may burn but can tan and has an increased number of nevi, while the other group is red-haired, blue-eyed people with fairly milky white skin, and these are exquisitely sensitive to light and do not tan well. In the second group, there is formation of the freckles, frequent formation of the freckles. The genetic mechanism for the pathogenesis of the melanocytic nevus is activating mutation in the RAS and BRAF pathways. The RAS and BRAF serine threonine kinase pathway is these are the pathways that downstream activity of MAP kinases are activated, and that leads to proliferation. But here in this nevi, this proliferation is for a limited period, as we do not see any uh, vivid or pronounced proliferative activity in nevi as we see in our as we see in other cancers that are due to activation of RAS and BRAF serine threonine kinase pathways. There is secretion or activation of cyclin dependent kinases 4 and 6, and this is for a limited period, because when they are uh, they are present in this particular environment, they are inhibited by P16 and INK4A, and this inhibitory activity stops the activity and cell here hence undergo into a growth arrest. This concept or this phenomenon is termed as oncogene induced senescence. The P16 or INK4A has got an inhibitory effect. When this protective mechanism is disturbed, then this condition leads to melanoma or development of melanoma. Now, what is the progression of a melanocytic nevus? What are the phases under which uh, what are the phases that it shows as the time passes? The melanocytic nevus begin to appear between the first and second year of the life, and it continues to emerge during the first 2 decades of the life. At first, it is a small tan dot that is 1 to 2 millimeter in size. Within 3 to 4 years after its appearance, it is uniform, tan, brown. It is circular to oval in shape, and the size increases, but still the borders are regular until it is reached to 4 to 5 mm in size. Now it is sharply demarcated and flat or slightly elevated. It stops enlarging peripherally, and it is sharply uh, demarcated. Then within next decade of the life, it is flat to pale, tan tag-like protrusion that is stable, and after decades of the life, in the later decades of the life, it regresses. The epidemiological studies have shown that the nevi are a strong risk marker for the development of melanoma. When some individual has got more than 100 nevi that are about 2 to 5 mm in diameter, there is threefold increase for development of melanoma as compared to the people who have got less than 25 similar nevi. If a person has got clinically atypical nevi, eh, if these atypical are even 10, he or she has got more chances to develop melanoma, at least 12-fold chance to develop a melanoma if he has got about 10 atypical nevi, or if the person has got histologically proven atypical nevi, he has got 12-fold increase for the increased risk for the development of melanoma. If the nest of the melanocytes are confined to the dermoepidermal junction, they are termed as junctional type of nevi. If these melanocytes are present both in the epidermis and in the dermis, they are termed as compound nevi. And if these melanocytes are confined to the dermis only, this is termed as dermal nevi. The acquired melanocytic nevi commonly are tend to brown and uniformly pigmented, and they are small, usually less than 6 millimeter across, and a flat macule. Uh, Then they can be elevated papules with a well-defined rounded border as seen in this picture. It is a dome shape, and this one is a shape, but the border is regular, and it is uniformly pigmented. The the junctional type is like a macule, but the compound type of the nevi are elevated or papular in shape, and this even distribution of this melanin denotes a benign process. There may be some prominence during pregnancy that indicates that these have got some hormonal sensitivity. The histological classification of epidermal nevus reflect their evolution. The junctional nevi are aggregates of round cells that grow along the dermoepidermal junction, especially near the tip of the rete ridges. The nevus cells are uniform and rounded in contour. They have got uniform nuclei, inconspicuous nucleoli, and they have got little or no mitotic activity. As it as the time passes, it grows into the dermis and now converts into compound nevi and has got the nevus cell in both the dermis and the uh, junctional nevus component. These are also nests or cords of the cells, the nevus cells, and as the lesion becomes old, in older lesion, the upper segment of this compound nevi are lost, and now the nevus cell purely present within the epidermis and within the dermis, and the epidermal nest lost entirely. The junctional nevi are flat in appearance, morphologically flat, while the compound and interdermal are elevated. At this stage of this dermal nevus, the pigment tend to be lost, and the presence of nested architecture is an important clue to the diagnosis of the nevus cell versus the tumors. This photomicrograph is showing a compound melanocytic nevus, and here these melanocyte nests are present both within the epidermis and within the dermis, while in this dermal melanocytic nevus, the aggregates of neva cells are entirely confined to the dermis. There is no nevus cell that is above this dermis. This illustration is showing the morphological changes or the maturation sequence of non-dysplastic melanocytic nevi. In the picture A, there is normally distributed melanocytes that are present in the stratum basal of the epidermis, and in B, there is nesting of these nevus cells, and this is called junctional activity. And in C, there is presence of both the component, the junctional component as well as the dermal component. As the time passes, the junctional component is lost, and now the uh, nevus cells are present entirely within the dermis. The C and D have got a raised morphology. There is raised papule and or dome-shaped papule. After some times, uh, the cells become smaller, and they have got cord or even isolated cells, and the nests that were present from A to D are now not present in the E, and this is termed as neurotization of these nevus cells. The nevus cells from A to E, they produce melanin, but little or no melanin pigment is produced from the neurotized nevus cells. As the lesion uh, goes toward the neurotization, as the nevus goes towards the neurotization, there is loss of the tyrosinase activity, and there is acquisition of the cholinesterase activity, and also this nevus that was elevated in C and D now start regressing, and this neurotization of these nevus cell is reminiscent of Schwann cells, as we know that these melanocytes are also derived from the neural crest as the Schwann cells are derived, and these are now a delicate neuromesenchyme that is present within the dermis. So eventually the nevus flattens. About 1 to 2% of the white children have got some sort of pigmented lesion of their skin. They may present as a small patch of pale tan hyperpigmented area, or a large pigmented patch or plaque that is cosmetically disfiguring, and as the time advances may develop giant hairy lesion or garment type of the nevus if they involve a large part of the trunk or involve extremity. They are, on the basis of the size, are classified into three types: the small one, medium one, and large one. The lesion less than 1.5 centimeters are the small one, while the medium one are 1.5 to 19.9 centimeter. The lesions that are greater than that are termed as larger lesion. The congenital nevi usually grow in proportion to the growth of the child, and color varies, as I have told you earlier. It varies from uh, pale brown to black, and it is considered that these lesions are due to abnormalities in the migration of the nevus cells, and these lesions, they mimic melanoma, as there is increased epidermal and dermal melanocyte. that these melanocytes extend deep into the subcutaneous tissue, and they are associated with malignant transformation. About 5% of these lesions uh, have shown malignant transformation. These melanomas or these malignancies may occur during childhood, and due to their large sizes, these lesions are inoperable. However, the laser excision, and is educated for these type of the lesion. Another lesion is Mongolian blue spot. These are congenital skin lesions that result from collection of melanocytes that are present deep in the skin, and these are present usually on the back. These lesions are macule, large, and can be multiple. This is seen most commonly in blacks and Asians. The Spitz nevus or tumor are also termed as spindle and epithelioid cell nevi. They are a tumor of children and adolescent, but less commonly they can occur in adult also. Grossly, they are elevated, fleshy, spheroidal pink, smooth nodules that are present usually on head and neck region. The growth of these Spitz nevi is rapid, and they attain the size of 3 to 5 millimeter within 6 months or less than 6 months. Histologically, they are composed of large spindle cells or epithelioid melanocytes, and these melanocytes are scattered within the epidermis and dermis both. There is presence of occasional giant cell also, and the growth is so rapid that sometimes uh, these are considered as melanoma. So as their histological picture is also showing that these cells are arranged haphazardly, and these are haphazard, and they are stereotypic uh, to some extent, and sometimes atypical also, but uh, they are usually misdiagnosed as melanoma due to these features. But these are benign. Most of these Spitz nevi are benign. Some of the nevi or Spitz tumors, they uh, tend to invade regional lymph nodes, and uh, but this is a very few cases that invade the regional lymph nodes, but these are termed as melanocytic tumor of unknown malignant potential or uncertain malignant potential. The genetic studies of these Spitz nevi shows that there is a copy number variation, and further studies can provide additional information about the assistance in decision making regarding therapy of these Spitz nevi. And unlike melanoma that shows point mutations, these Spitz nevi uh, show fusion gene rearrangement or chimeric protein expression in them. Blue nevus occur in childhood and late adolescence, and they are grossly dark blue, gray, or black, firm, well-demarcated papules or nodules. Actually, these blue nevi are collection of deeply pigmented melanocytes that are situated deep in the dermis. That accounts for their deep slate blue color, and they are confused with melanoma clinically. Hence, biopsy is required to differentiate these lesions from nodular melanoma. They are present on the dorsum of hand and feet or on buttock, scalp, or face. Histologically, they are composed of melanin containing melanocyte with long thin dendrites that are present in the superficial and mid dermis, and these are often mixed with numerous melanin containing macrophages. The Here this picture is showing, this photomicrograph is showing histological changes. These are elongated cells with heavily pigmented dendrites and a small blend nuclei. The cellular blue nevi and malignant blue nevi have also been described, and these are rare. Halo nevus is another form of melanocytic nevus, and in this nevus there is a surrounding halo of depigmentation, and patient may have several nevi simultaneously, and they are due to development of antibodies against the melanocyte. Eventually, due to development of antibodies, whole of this nevus may disappear. This table is summarizing the various forms of the melanocytic nevi. The congenital nevus, that is deep dermal and sometimes subcutaneous growth that is present around the adnexa. There is presence of neurovascular bundle and blood vessels are also there, and the cytological features are identical to ordinary acquired nevi, and the clinical significance is that they are present since birth, and the large variant, the large type of these congenital nevus have got increased risk of melanoma. The blue nevus, histologically, it consists of non-nested dermal infiltration, often with the associated fibrosis, and the cytological features are highly dendritic cells with heavy pigmented cell nevus, and there is also presence of macrophages that have got the melanin within. And these are clinical significance is that these are blue black nodules, and they should be differentiated from nodular melanoma. The Spitz nevus has got fascicular growth, and cytologically they have got large plump cell with pink blue cytoplasm and fusiform cells. They are common in head and neck region, and in children red to pink nodule, and they are confused often with hemangioma. Helonevus has got lymphocytic infiltration surrounding nevus cells, and these are identical to ordinary acquired nevi, and clinical significance is that they have got host immune response against the nevus cells and surrounding normal melanocyte, so they form a nodule. This plastic nevi we are going to cover in the next video. There is a coalescent intraepidermal nest with cytological atypia, and these are the potential markers for or precursors of melanoma. It is worthy to mention here the distinguishing features of a benign mole and malignant melanoma. Clinically, the benign mole is symmetric. The borders are well demarcated, uniformly pigmented, and the diameter is less than 6 millimeter, unless the other varieties that we have discussed. The common location is skin of face or mucosa. Histopathologically, the mole has got architecture that is composed of nesting. Cell morphology is uniform, like nevus cell. The melanin pigment is irregular, and there is coarse clumps presence. Inflammation may or may not be present, and it is localized to an area. It do not usually spreads, and possesses cosmetic problem only.